It's a day many people have longed for, but if you're experiencing anxiety about a return to something like normal, you're not alone. Mental health experts say so-called reopening anxiety is real, widespread, and to be expected. Joining us now to tell us more is Dr. Aderonke Pedersen, instructor of psychiatry and behavioral sciences at Northwestern Medicine. Dr. Pedersen, thank you so much for joining us.
Thank you for having me.
Given that so many people have looked forward to an end of the pandemic for so long, why might reopening and this return to normality trigger anxiety?
For the past 15 months, we've been in a heightened state of awareness about our surroundings, about who's around us. In making decisions about socialization, we've had to think, 5, 6 steps ahead of what we might have been doing prior to the pandemic. So I think it's only expected that after such a long period of, in some ways, an anxiety provoking, circumstance and context, that moving forward, there would be some apprehension, some anxiety for different reasons, certainly for different people.
What are you seeing or hearing in your own practice?
Patients, community members that I work with and some of the research work I do are talking about feeling anxious about being around people, even when they know they're fully vaccinated. And this sort of hesitancy when you're coming in close contact with people, that even if you're not wearing masks, should we hug? Should we, embrace each other, or should we still somewhat be socially distant? So I think there is some level of, I thought by this point, people saying, I thought by this point I'd just be, completely ecstatic and happy and ready to, fully launch back into full socialization mode. But there is hesitation, there is, anxiety and a heightened awareness, that's still following us and lingering at this time.
What would you say causes the most stress for some people? Is it, a return to working in person, public transportation, going out to eat?
I think a return to work seems to be coming up more and more because different organizations and employers are following different guidelines or practices in terms of within their own organization. And I think there's also a lot of commentary around this idea of, could we have hybrid models? People saying, I've enjoyed not commuting an hour to work, or a couple hours a day, or the traffic that comes with coming into work, or I don't exactly know what everyone has decided to do at my workplace. I'm not really sure if everyone around me is fully vaccinated. So I think I'm seeing a lot of people having hesitation around return to work.
So we know that the pandemic has not impacted everyone equally. We know that the disproportionate impacts have really been in the Black and brown communities. And of course, there was the racial reckoning in social justice that's happened over the last year as well. What kind of stress or anxiety might those communities be facing as reopening progresses?
So I'm so glad you brought up that question, because I think it highlights the importance of the fact that our recovery might not look the same, certainly as individuals, but our recovery might not look the same as communities too. That there are different things that Black communities have experienced, brown communities have experienced because of the disproportionate impact of COVID-19 itself, but also because of this racial reckoning, that we experienced in 2020 into 2021, and I hope continues to happen. But I do think that when it comes to things like racial trauma, that we have to think about the compounding effect that COVID-19 has had on us as a community, on Black people in particular, but also the fact that racial trauma, we know based on research that has been done, is something that can impact people on a physical level as well.
What are some of the ways that you recommend to people as far as how to cope with their anxiety and how to know when they should seek professional help?
Anxiety is certainly on a spectrum, and even things like feeling fatigued or emotionally distressed and something like depression. And so it's important that people are paying attention to when anxiety is starting to affect their day-to-day activities, when it's starting to affect your sleep, your appetite, and that in paying attention to that, you're taking preventative measures. So if that means taking a break from activities, that induce that anxiety or cause you more stress. But if you start to notice that the symptoms of things like lack of sleep, tension in your body, in your muscles, headaches, abdominal discomforts or stomach discomfort that's just continuously happening to you, then that's the time to say, let me talk to my primary care doctor if you don't have a therapist or a psychiatrist, but certainly don't let the stigma of mental health keep you from going and seeking help, because that's the most important thing we can do in this recovery phase.
And Dr. Patterson, is it possible that one of the good things to come out of this pandemic might be a greater awareness of and empathy for people who might be struggling with mental health issues?
I'm certainly grateful that we're talking about mental health more and more. And I hope that we continue to do that, because it has such an impact on us, not just in terms of our mental health itself, but like I mentioned earlier, in terms of our overall wellness, overall physical health. And so I hope that this is a time where people can look and reflect and say, talking about my mental health doesn't mean I'm weak, doesn't mean there's something, inherently wrong with me. All that it means is that I'm able to recognize. And in fact, it's a strength that you're able to recognize when you need help and get the support that you need.
Okay. Dr. Aderonke Patterson, thank you so much for joining us.
Thank you for having me.